Good morning and welcome to UroNurse News. I'm Vic Senese. Today, an important update that could change how we approach prostate cancer recurrence after surgery. A major new meta-analysis presented March 2nd at the American Society of Clinical Oncology Genitourinary Cancer Symposium in San Francisco and simultaneously published in The Lancet suggests that most men receiving salvage radiation after prostatectomy may not benefit from hormone therapy, especially if their PSA is 0.5 nanograms per milliliter or lower. So what was studied? The study, called Poseidon, was presented by Dr. Amar Kishan of David Geffen School of Medicine at UCLA. Researchers analyzed individual patient data from over 6,000 men across 6 major phase 3 randomized trials, including the RAWTAG 9601, the GTUG 16, the RAWTAG 0534, and the 3 radical trials. Median follow-up, 9 years. This was commissioned by the MARCAP Consortium and represents the strongest level of evidence we have to date in this setting. Hey, key findings. Hormone therapy only showed meaningful survival benefit in men whose PSA was above 0.5 at the time of salvage radiation. For men at or below 0.5, no overall survival benefit, no metastasis-free survival benefit. Now that's practice changing. The numbers, let's look at the absolute difference at 10 years. With hormone therapy plus salvage radiation, overall survival was 84.3%. With radiation alone, 83.6%. That's less than 1% absolute difference. Now, metastasis-free survival was 77.9% with hormones versus 74.1% without. A modest difference, but again, not translating into meaningful overall survival improvement for lower PSA men. And remember, hormone therapy is not a benign treatment. So, let's talk about some side effects. We're talking about hot flashes, sexual dysfunction, metabolic changes, bone density loss, cardiovascular risk, and quality of life impact. Dr. Kishan noted that for men with milder disease, any cancer control benefit may be offset by the other cause mortality, especially given that list of side effects I just said. So, who should benefit? The subgroup that appeared to derive benefit, men with postoperative PSA levels between 1.6 and 2.4. And even then, the data suggests that short-term therapy, 4 to 6 months, may be sufficient rather than 24 months of continuous long-term hormone therapy. There's a discussion of intermittent approaches in appropriate patients. Now let's be balanced. These trials spanned from 1998 to 2015. Advanced imaging like PSMA PET wasn't available. Genomic tools like Decipher weren't incorporated, and 70% of men receiving long-term therapy were from the RAWTAG 9601, which used bicalutamide monotherapy, not modern ADT regimens. So this isn't a perfect reflection of today's technology. This is about personalization. Not every man with a rising PSA after surgery automatically needs hormone therapy. PSA level at the time of salvage radiation appears to matter significantly. Shared decision-making matters, and emerging trials like Balance trial may help identify biomarkers to determine who truly benefits. Some final thoughts? Some patients may still value even a small metastasis-free survival improvement, even without overall survival benefit. That's patient-centered conversation, and that's something you should be talking with your doctor if you're a patient. But the day of reflexively just adding long-term hormone therapy to salvage radiation for everyone, those days are numbered, folks. This Saturday on UroPatient, we're asking a question that should protect your independence. Is your home really safe? You know, most serious injuries at home don't happen because of something dramatic. They happen because of small things we overlook. A loose rug, poor lighting, one misstep on the stairs, slippery bathroom floor. And for those managing urologic conditions, nighttime bathroom trips can increase the risk even more. In this episode, I'm going to share simple, practical changes you can make right away to reduce your fall risk. prevent serious injury, and stay independent longer. Hey, maybe to live longer. These are not an expensive renovation either. They're smart, nurse approved by this nurse, safety upgrades that could make a real difference. Join us this Saturday for actionable tips that could help protect you or someone you love. These are all tips that I've implemented in my house too, because, I am getting older. Tomorrow on UroNurse News, is intermittent fasting really the secret to weight loss, or just another diet trend? We break down the latest evidence for adults with overweight and obesity. What works, what doesn't, and what the research really says. So join me for a clear, evidence-based look at intermittent fasting versus traditional calorie restriction. Don't miss it. Tune in tomorrow for your weekly update on health, nutrition, and lifestyle strategies you can trust.
Breaking news, clinical guidelines, and research insights, delivered weekdays at night, designed specifically for busy urology professionals. UroNurse News, your daily update.